News 5 Digital Desk this morning, and we've got a special guest with us this morning here for a live interview. We're going to be chatting about student therapy. Now, this person is joining us all the way from New York City, and he's got a lot to talk about. We've got Michael Elson Rooney from Chalkbeat in New York, and like I mentioned, student therapy. That is going to be the conversation in the next couple of minutes. So let's get to Michael here in just 1 second, and we've got it right there. Hey, Michael, how's it going?
Hey, good. How are you?
Very good. Glad you are joining us. We're all the way down here in the South in Memphis, Tennessee. I know you're up there in New York, but let's chit chat about something that impacts folks really across the entire country, students and therapy. Tell me more about your article.
Yeah, so what I was looking at is, over the past couple of years, we've seen this youth mental health crisis really kind of taking off, in the wake of the pandemic. And schools are trying to figure out ways to get students more help. And that often means, putting them in touch with therapists or offering online therapy, just ways to help them cope with mental health challenges. But we started hearing from some students, from some mental health professionals that one of the obstacles that comes up is that often kids still need parental consent to get therapy. And, parents, for a whole range of reasons, have reservations about that. And so that's something that schools and families are navigating as they're trying to increase the access to mental health treatment.
Now, Michael, I know that in your article you talked about some states have different ages when it comes to consent with therapy. So can you kind of touch on that a little bit?
Yeah, so we see a whole range, on the low end, states, including California and Colorado, have moved to give young people the ability to consent to most mental health treatment at starting around 12. There are other states that don't even set an age. They say just when students are developmentally ready. But then, many states, I was looking a little bit at Tennessee, and it looks like there's some limited circumstances where kids at age 16 can start, but mostly for minors under 18, it requires parental consent.
Now, when it comes to having these conversations from parents to students to teachers, it seems like there needs to be some kind of consensus as to how these conversations are happening. And so, what have you learned about the way parents should be talking with their kids if they're interested in something like therapy, especially kids at a young age, those 12 and younger?
Yeah, so I think, one common thing I heard is that whatever the law is, I think pretty much everyone agrees that it's certainly preferable when parents are on board, and it makes the treatment more effective when, kids know that their parents are supporting them in it. Um, so, I think social workers and counselors at schools are really thinking about how do we bring parents in? How do we kind of dispel any myths about what therapy is and isn't? How do we kind of remove some of the stigma here that, this doesn't mean there's something wrong with your kid or that they're going to be labeled for the rest of their life, but that this is something that can really just help.
Now, Michael, you also touched on the disparities between different communities when it comes to therapy for students. Can you touch on that also?
Yeah, so the latest figures from the CDC showed that about 14% of white students, white young people had reported seeing a therapist. And then for every other group, the percentage was lower, with the lowest being Asian American kids, where only about 3% of them reported having seen a therapist. And, there are some long-standing issues here when it comes to how groups have been treated by mental health professionals and social services, and some skepticism that goes back a long way. And in immigrant communities in particular, the kind of the barriers can be higher.
Absolutely. And one other thing, I know that you kind of talked about were the different perspectives, I guess, from the different regions. I know you're up there in New York, so this is a very different conversation that we're having here in southern states. Can you also talk about that?
Yeah, so, like many things in education, this is kind of gotten swept up into politics, especially over the past couple of years. And, we know that there have been so many conversations happening about what is the role of parents in deciding what happens in schools. And this is certainly one of the most personal things that parents and kids can go through. And so, it's impossible for it not to get kind of swept up in the political debate too. But, talking with families, the issues are often really personal and nuanced and individual to their circumstances and their backgrounds and their upbringings.
All right, well, that about does it for our time that we have this morning. Michael Elson Rooney with Chalkbeat New York, thank you so much for your time and joining us right here on the Action News 5 Digital Desk down here in Memphis.
Thanks for having me.